Action.
Hi, good afternoon, everyone. Welcome to She Talks. It's me, your host Dania Hussain, for today for She Talks Season 2, where we dive deep into the journeys of inspiring women. And today we have one such woman with us who is Miss Joanne Rico. She is a marketing and branding specialist from the healthcare industry, and she has also authored and co-authored various books. So now we shall dive deep into the secrets and know how she has been doing this. So welcome Miss Joanne to our show She Talks, and thank you so much for joining us today.
Thank you, Dania. It's a pleasure to be here in your show. Thank you so much for inviting me.
Thank you so much. Now, like I will say that okay, now we shall start with our conversations and then we will ask you the questions. Okay.
Okay.
Now we shall, try to discover the secrets of Miss Joanne, how she has, been doing this branding and marketing, and that also in the healthcare industry, and that also she has a experience of more than 15 years, and she is making a mark. So let's discover what her journey is all about. So, Miss Joanne, could you, share a little bit about your professional journey and what led you to, to the healthcare marketing space? Why did you choose healthcare only?
That's a very interesting question to start off, Dania. Unlike my counterparts in marketing, I actually came from grassroots,
Mm.
right? So my grandfather was a barber. Alongside with him was my grandmother is a housewife.
Mm.
And then I'm a child of solo parent. My mother was raising me and my siblings, three other siblings, alongside with my late aunt. And we really had to study hard
Yeah.
to earn scholarships so that we can go to school,
Mm.
right? And then a few years down the line, I thought life would be easier after I graduated, but
Yeah.
it did not actually. So when I started applying for jobs in marketing, I got rejected not only once, not twice, but several times over. And then, I promised myself this should not be, the case. I feel that my purpose is really in marketing. So I really strive hard to, I started with sales and then I went to customer service. And then one fine day, I applied for marketing again. And my then employer, saw the fire and the grit, that I have for marketing. And then he opened the door for me. So that was my first break in marketing. And from then on, I had to make sure that I leave legacies.
Yeah.
At age 23,
Mm.
I became the youngest advertising and promotions manager in the largest retail chain of convenience stores in the Philippines,
Mm.
right? And then after that, I became part of a hospital in Qatar, right, doing healthcare marketing. And that was actually my first break in healthcare marketing. And then after that, I became part of huge brands in the UAE, like Virgin Hospital Group and NMC. And now I'm in the space of healthcare marketing and government, which is part of SEHA,
Yeah.
right? And we operate under Pure Health, and name of the brand is Salma Rehabilitation Hospital. So I think it was a very colorful, journey. I'm now in the industry for almost 20 years, right? Spanning brand management and marketing in diverse industries in Philippines, in Qatar, in UAE. It was not an easy journey, but
Yeah.
I made it.
Great, amazing. So why did you choose healthcare industry only? And because since you are so good at marketing and branding, so why was it only healthcare?
It's an interesting question, Daniel.
Yeah.
Because when I started in marketing, it was really in retail and in convenience store, right? And we're marketing products over there. When I transitioned to healthcare marketing, I realized that this is actually not about products, not about just services, but really about human impact, right? It's about connecting with people. It's about human lives, right? It's about people. So what is very interesting in healthcare marketing is that we measure the impact of a marketing campaign not in terms of sales of the products, but in terms of the lives that we have touched. So that is very transformative for me.
Amazing. So, as a marketing professional for healthcare institution, how, your role is different compared to other marketing professionals because you're doing the marketing for the healthcare. And so, how your role is different.
Oh yes, it's very different, Dania, because we are talking here about trust.
Yeah.
Trust comes first,
Yes.
and then branding comes second,
Yes.
right? In other practices of marketing, branding comes first, and then you gain the trust, you gain the loyalty.
Yeah.
Here in healthcare marketing, we're talking about building the trust first, gaining the loyalty, gaining that emotional connection first before you're able to actually sell, quote unquote, your products or your services to the people. So I think what made it very different is that we are looking more on the connection, right, with people, having to build that trust, and then only then we think of, okay, how do we market this, right? How do we build a story around this, right? So that's very important, and I think most marketers in healthcare can actually attest to that. It is not easy because we're not measuring products sold, right? We're not measuring how many people purchased our goods, but we are really measuring how many lives were impacted by our services.
Amazing. So, what does a typical day in your role look like? If you can just give an insight.
Oh yes, I know. In marketing, when I started, my journey in this field, it is really, there's no one typical day, if I may say that, because at one hand I may be reviewing literatures, right?
Yeah.
Education, patient literatures, and then shortly after I will be aligning with a doctor for a campaign, right?
Yeah.
An outreach campaign that we're going to do. And then later in the afternoon, probably I will be presenting a brand strategy to the executives and leadership,
Yeah.
right? So it's really a crazy kind of, lineup of activities on a daily basis. So it's never predictable what's going to happen. But what I can say is every day is always a balance of creativity and compassion, right? So I have to always make sure that in everything I do, whether it's a campaign, it's an advertisement, it's an event, it's a digital post, right? It has to have a balance of creativity and compassion as a substance of the message.
Amazing. I think only you can. You have been able to do this. I don't think anyone
Thank
else,
you.
anyone
Thank you.
else, because it's really difficult.
It is difficult. It is. Yes.
And there are targets also, that.
Exactly. To have that measure, right? Everybody's, running for top line,
Right.
and bottom line.
Of
How
course.
much revenue are you able to
Yeah.
drive? To actually have that on top of your head, at the same time making sure that the people that you communicate to are actually seeing you not just as data, but really as people, as who they are,
Yeah.
right? That balance has to be there. And I think in every healthcare marketer, that's something, a skill set that has to be improved upon every time.
Right.
Because, again, we're not selling products.
Definitely.
We're selling, service with
Yeah,
a care,
of
with
course.
compassion, and we are here to inspire
Yeah.
people. Yes.
Amazing. So, how do you build trust with the patients and, the community through marketing?
That's a very interesting question. I always, say to myself whenever I do a campaign, I always ask, who am I talking to?
Yes.
Right? Because sometimes as a marketer, we tend to first speak, then
Yeah.
listen, right? As a marketer, I think whether in healthcare or in retail, it is very important to really listen to your customers first, rather than speaking and then sending the messages. First listening to them, and then from there, you send the message out. And I always make sure to, as a second, rule of thumb for me is that I look at the people, right, rather than the platform, right. I always make sure because there's nothing that will make me more fulfilled if I see. I'm so sorry about
You
that.
can silence
So
it.
sorry.
It's
That's an alarm actually.
okay.
So sorry. Let me just. Let me just remove all the
Sure,
alarms.
sure. Oh, reminders.
Reminders, yes, I will. Sorry. Then is it okay we go to that same question?
Yeah, sure. We will just
Yeah.
to do that, and I will ask you.
I remove all my alarms.
These are reminders.
Yeah, my reminder that is actually my medicine reminder. Okay, so. Okay.
So, how do you build trust with the patients and the community through marketing?
Yes, that's a very interesting question, Daniel. Whenever I do any kind of campaign, I have to make sure of three things. First is that I talk to people, right, rather than platforms. I make sure that the people comes first rather than understanding what is Facebook, what is Instagram, what is WhatsApp, right? I always prioritize talking to people rather than with platforms. The second way of building trust is really to make messages more personal. I remember talking to a patient rather than to, I know we're talking to the masses, but I make sure that I actually keep in mind that I am talking to one person, even if it resounds too many, right? Because when you know that you're talking to one person, you make your messages more personal, right? More emotional, and more straight to the heart of the
Yes.
person you're talking to,
Yeah.
right? And the third approach that I use to make to build the trust of the patient is to make sure that I listen first, right, before I speak. Because sometimes, and this is also an error for not only
Yeah.
marketers but a lot of entrepreneurs also, and I know you can resound to
Definitely.
this. We tend to kind of put our message first before we even listen, but in fact, the whole perspective should be the reverse. You have to first listen before you speak so that you will know if what you're speaking actually resounds to the person that you're talking to. And therefore, you will be able to connect more emotionally with that person.
Definitely, that's a very nice approach.
Thank you.
I must say that. Okay. So also, healthcare can be a sensitive space. So what are some of the unique challenges you face in promoting a hospital brand?
Oh, that's very interesting. A lot of healthcare marketers always have the challenge of the regulations, right? Because in healthcare, you have very strict regulations, and therefore you cannot sensationalize, right? You cannot exaggerate, right? You always have to remain within the facts,
Yes.
right? Of science, right? But I think one of the things that I always say is that creativity is actually moving within the constraints of regulations in healthcare marketing, right? So we craft messages not on the basis of exaggerating them or over sensationalizing them, but really to show the stories of change, right?
Yeah.
To show the stories of healing, right? To show the stories of how did this particular surgery transform the life of this person, right? Or how did this particular procedure help the person regain the confidence in his life, right? So the regulations are a constraint, but I think if the marketer will be creative enough, there will always be a balance between creativity, science, and storytelling.
Amazing. So, can you share a campaign or initiative in your work in healthcare that you are especially proud of, since you mentioned, you're doing so many campaigns and all that? Can you just give an insight of one such campaign?
Oh, yes, I am very, very proud of this campaign actually. When I joined NMC in Abu Dhabi, it was actually an underperforming hospital,
Yeah.
that we had to take over.
Mhm.
And because it is underperforming, I had to do a very intensive research and understanding of why is it underperforming, right? And then what I realized is that it is underperforming because there are actually gaps in patient trust. As I said earlier, in hospital, trust is very, very important, right? And we have seen that, one ad will promise one thing, but the operations cannot actually deliver that for this thing that we're promising, right? So for instance, you're saying that ER open 24 hours, right, 7 days a week, yet, the patient time probably is very long in the waiting time for ER, right? So there's that gap in terms of trust, right? Patient trust to the hospital or to the brand. So this was one example. So I had to do a very intensive research and analysis of the hospital. Why is it underperforming? And after series of interviews with patients, after a series of interviews with internal stakeholders and different teams involved in operations, then I was able to actually create a strategy. How do we regain patient trust, right? And how do we connect with the communities around us so that they will actually understand that we're not just a provider, but we're actually a partner, right? In their daily recoveries or in their daily struggles in health, right? So I had to manage campaigns that revolve around that, and within 6 months time, we were able to actually turn around a facility that's not performing for 3 years. So I must say that, that is one. Another campaign that I'm very proud of, which very recently I had, help with in my current company, Seha Salva Rehabilitation Hospital, is involving our families, right, in the journey of rehabilitation and healing of our patients. What most people don't know is that in rehabilitation, the healing journey does not happen with just the patient and the caregiver, right? Or the patient and the therapist, or the patient and the doctor. Most of the time, families must be involved in the care, in the healing journey. And to create campaigns that actually resound that is something that I'm very proud of, because we have seen how the progresses of the patients who are with the families and with their families involved in the care planning, right, and the healing journey, it really makes a meaningful difference.
Amazing. So, in your view, how has healthcare marketing evolved in recent years, especially with the social media's influence?
Oh, definitely it has, evolved like almost 180-degree turn, because in the past, right, hospitals will just release an advertisement and nobody will be able to challenge that advertisement, right? But with social media, it became a conversation. It became a dialogue, right? So the shift was from just an institution talking and selling the product, selling the doctor, selling the services. It became now a dialogue where the patients and the community can actually give their reaction also about your products and your services and your doctors, right? So the shift actually became from institution center to now patient center, right? And the patient center becomes a dialogue with the provider and the community, and that the expectations were raised also higher, because they are expecting us, right, as healthcare providers, to be more transparent, right, to be more authentic, and to also engage them in a dialogue. If they have complaints, right, we have to be able to give the resolution, right, or we have to be able to at least engage in the conversation of why actually this happened, why the gap happened, right? And I think social media has been very helpful in driving these conversations. It became one-way to two-way street conversations, and it is helping us to improve our services and our products, every day.
Right. So, how do you balance the need for creativity with strict healthcare regulations?
Oh, that's very interesting, I remember I was working with an agency for advertisement in cosmetology, right? And when you talk about cosmetology, imagine with me, you're talking about skin, right?
Yeah.
Hair, right? So there will always be a time that you will have to show the skin over here, laser hair
Yeah.
removal, so the underarm should be shown,
Yeah.
right? And even the skin on this the lower part of your body, right? So that's automatic in every other region, right? Or
Yes.
in another country,
Yeah.
like you talk about US, Canada, or even Asia in general. But when you go here in the Gulf, where restrictions say you cannot show this, right? You cannot show underarms, you cannot show. So how do you do that, right? How do you communicate a service that actually caters to those parts without showing it, right? So it's really a challenge for most of us because there are regulations that we have to follow. And if you don't follow, either you get a penalty, right? You get a fine for not following the rules, or you have to really take down whatever it is an advertisement that you have put, or a social media post that you have put up, or probably you will also be, if after several times you are actually not following the rules, the the the, the authority can actually shut down the clinic or shut down the establishment, or the hospital that you have. So as a marketer, our challenge is, how do you communicate these services that actually without crossing the regulations, or without violating the regulations. So I must say that one of the key things that we have to remember is to be sensitive, right, to culture. I think this is one of the things that newcomers here in marketing, right, in healthcare marketing would know, because they think that, okay, I have seen everything, in other regions, I have seen all these things already, I know how to do. But when they come in, they realize they have so much to learn because of regulations and cultural sensitivities. So I think for the marketers who are actually out there planning to join our region as diverse as UAE, or probably as conservative as that of the other countries in the Gulf, the key is to really understand the culture, right, and be sensitive enough to draft campaigns that are working alongside the culture and not against it. Yes.
Can you just take a break for 5 minutes?
Okay.
And come through.
All right.
I'm just coming. Okay. See the things.
I think we have covered a good
Yeah, mostly. Do you want to go?
No, I'm okay. I'm okay.
Fine.